Well, thank you. I have Sherry Lauer, Regional Chief Quality and Compliance Officer for Kauai Veterans Memorial Hospital.
Yes.
In Hawaii.
In Hawaii.
Yes, we love Hawaii. So thank you for taking a couple minutes. Two brief questions. Number one is really, what were the main drivers for you guys to decide to purchase a population health management platform?
Data. We wanted to be able to retrieve our data. We felt it was very important that we had this amazing new EMR system, but we just weren't able to get the data out of it that we needed for quality. And as the Chief Quality Officer, I'm all about the data.
It's big. That's
the
big.
data metrics. And you have to always be looking at how you can improve yourself. And your system allows us to look at our data, figure out where we need to make adjustments and changes, and then also be able to do better patient care and improve our patient outcomes.
Awesome. Data is number one. As I sometimes say, data is the new currency.
Yeah, it is.
Especially in healthcare.
Absolutely.
But you mentioned, using the data for your clinical teams, your administrative teams. What are just one or two of those big value propositions that you guys have been able to get out of it?
Being able, well, it's not even just for our teams, it's also for our reportables. So we need to report a lot of the data to our Medicaid individuals, our insurance companies. And, from the quality standpoint, you have so many different departments to get quality dollars back from. You have to have the data to prove that you're doing the work. And the huge value added that we've had is being able to pull that data out, get it where we need it to go. We also have been able to use it to really modify systems to improve our patient outcomes, improve physician performances, improve nursing documentation, and making sure that everything is being mapped where it needs to go. And we did find, with the big value with this, is we weren't documenting things in the right place in Cerner, because you can document in so many different areas. For us, we needed to modify and say, let's do this workflow instead, and let's make sure that we document here every time so that we can pull the data out. That was a huge driver for us with our optimization with our Cerner product. So huge driver for that was using our I2I resources.
Awesome.
Thank you.
Thank you. Thanks for taking a couple minutes. We really appreciate you coming to the conference. Obviously a long way.
It's a long way, but it's worth it. And there's a lot of information that we've gained from coming here, including even talking with the other facilities.
Yes.
And I am recruiting. They're all going to be like, that Lauer lady is trying to hire us for Kauai.
Well, if they want to live in Hawaii, it's a pretty
great
good
place to
Yes. Well, thanks for your time.
Thank you.
I appreciate it.
All right. Take care.